Post-transplant. This book has been divided into 2 videos. Firstly, during your hospital stay, and second one, after discharge. In the hospital, you will be kept in isolation in the hospital for recovery after your transplant, so the transplant team can prevent and manage your side effects. Remember, your safety and comfort is paramount. The risks and complications of an allogeneic transplant are caused by the following: side effects of high-dose chemotherapy and/or radiation therapy, the period of lowered blood cell counts, neutropenia, anemia, and thrombocytopenia, organ toxicities, and graft versus host disease. Let's first look at your full blood count, or FBC. It is important that you understand what your FBC is and why we check it all the time. The FBC is divided into the following. First of all, your white blood cell count, or WBC. This is the number of all of the white blood cells that fight and prevent infection. The differential cell count, or diff count, is to determine the number of specific types of white cells that is most important in fighting bacterial infection. Neutropenia especially has to be monitored. Let's look at hemoglobin. The level of hemoglobin is the red blood cell's ability to carry oxygen. Normal levels are between 13 and 17 grams per deciliter. When your hemoglobin is low, it is called anemia. Packed red blood cells are generally transfused when the hemoglobin is less than 7 grams per deciliter. Platelets. Platelets help prevent bleeding. The normal values are between 150 to 450 times 10 to the 9 per liter. Platelets are generally transfused when the platelet count falls below 10 times 10 to the 9 per liter, as there can be bleeding in the presence of a low count. When platelets are low, it is called thrombocytopenia. We know that after receiving conditioning, your full blood count numbers will all drop way below normal. For each type of blood cell, there are specific risks and safety measures to be aware of. Let's look at neutropenia and neutropenic precautions. So neutropenia is a white blood cell count of below 1 times 10 to the 9 per liter. Neutropenia is a condition that requires extreme caution. Imagine that your immune system is an army that protects your body from invaders like bacteria. And neutropenia is like the whole army taking a vacation at the same time. What to do? Clean your hands frequently with soap and water. That means after going to the bathroom, before and after meals, after walking in the hallway, or handling magazines and other items that may have been touched by other people. Make sure that others clean their hands before touching or assisting you. Do your mouth care at least 4 times a day. If you have dentures, these need to be removed and cleaned too. Cleanse and dry the rectal area after each bowel movement. If you have diarrhea, let your nurse know because it can cause a skin irritation. Do not use suppositories or tampons. Shower and look at your skin daily. Any rashes or sores, redness or cuts you see or feel, tell your nurse or doctor. Use an antimicrobial and antifungal soap. Sani soap or bioscrub will be provided, and apply antifungal powder to your skin folds after towel drying. Please do not use soap from home. Keep your room free from clutter so that the housekeeping staff can clean well. Do not save leftover food at the bedside. Your full blood count will be done daily following the transplant, and your white blood cell count may reach 0 for several days. If you get a fever, which is a temperature of 38 degrees orally or 38.5 degrees temporal or higher, your nurse will obtain blood and urine cultures right away, and IV antibiotics will be started. Keep in mind that almost all transplant patients get fevers. However, attention to strict personal hygiene is the best way to prevent infections. Some symptoms of infection can include shaking chills, cough or sore throat, redness, swelling or pain in any body area, a sore or blister in any body area, including the mouth, and difficulty urinating. So cloudy or bad smelling urine are warning signs. Let's now look at anemia, which, as we said, was a low hemoglobin. Anemia could cause dizziness, shortness of breath, headache, pounding heartbeat, and fatigue. Please let your nurse know if you experience any of these symptoms. A transfusion of packed red blood cells may correct the anemia. In general, we transfuse when the hemoglobin drops below 7 grams per deciliter. This fatigue that may be experienced often contributes to feeling down or depressed. But as your red cell count recovers, so too will your mood and energy level. However, you may need additional emotional support during this time. Try some light exercise every day, even if you don't feel like it. Challenge yourself. It will improve the quality of restful periods and help you sleep better at night. Just a caution, a shower that is too hot or too long may cause you to become dizzy, weak, and fatigued as well. And lastly, let's look at thrombocytopenia and bleeding precautions. As we said, thrombocytopenia means low platelets. Remember, platelets are involved in blood clotting. When you cut yourself, platelets plug the injury and stop the bleeding. The conditioning regimen will cause your platelets to drop way below the normal level. When platelets are low, then it is called thrombocytopenia. This condition carries a risk of spontaneous bleeding, and the bleeding could occur on the outside, such as a nosebleed, or on the inside, in the brain or in the gut. Platelet transfusions can correct low platelets. In general, platelets will be infused through your PICC line when your platelet count drops below 10 times 10 to the 9 per liter. Most patients do not have any serious problems with bleeding after their blood and marrow transplant. However, it is a good idea to exercise caution when your platelets are low. And here are some important safety tips to follow when your platelet counts are low. Call your doctor or nurse immediately if you notice any of the following: bleeding anywhere on the body, a headache, confusion, or changes in how well you can see or walk or move, black or bloody bowel movements, bruising or red spots under the skin. Use a soft toothbrush for all your oral care. Floss regularly if you already do so. Dab your nose instead of blowing it or picking it. Do not bend over so that your head is lower than your heart. And do not use nail clippers. Electric razors are okay. If you're a menstruating woman, you may be given medication that prevents you from getting your period. If your period starts, sanitary pads should be used instead of tampons. Another important aspect to consider is high risk of falls and fall injury. Falls are very dangerous after SCT when blood counts are low. Your risk factors may change daily, and the following are high risk factors for falls and severe injury: drowsiness or weakness, unsteady or poor balance, confusion and delirium. Peripheral neuropathy, a decrease in feeling sensation, numbness and tingling in either your fingers or toes. Postural hypotension, a drop in blood pressure when moving from lying or sitting to a standing position, causes dizziness or lightheadedness. And anemia, a drop in blood cell counts, may make you feel more tired and weak. Various medications may also increase a risk fall. These include medications that either make you tired or dizzy to treat pain, sleep, or anxiety. Antihypertensive and diuretic medications may affect your blood pressure. Many commonly prescribed medications can cause changes in sensation, balance, blood pressure, alertness, and drowsiness. Do you know the side effects of your medications? How do we screen for falls? The nursing staff will screen you for your fall risk level, assess your blood pressure, balance, and walking ability each shift and throughout each day. Your risk factors for falls may change from hour to hour. They will ask you questions about changes in physical or mental status. Please notify the staff of any changes in how you feel or think. When you are at a higher risk for falls and injuries from falls, there are many measures that we can take to prevent falling. Rounds. The nursing staff will make rounds every hour to assist you with any of your needs, such as getting up to the shower or using the bathroom. The nurse call light. We will make sure that the nurse call light is within your easy reach. Please use this call light to ask for assistance if you are considered a fall risk or feeling dizzy, faint, tired, or weak. A fall risk door sign and wristband. Wristbands and door signs help to remind both staff and family members that you are at risk for falling, so that we can better assist you. Physical therapy. This may provide muscle strengthening, walking and balance training. Walking aids. A walking device can help maintain balance, and we provide non-slip socks and recommend non-slip footwear such as tennis shoes. Falls can result in bone fractures, injury, wound infections, severe bleeding, increased length of stay, and longer recovery time. Also, higher costs and even death. Let's work together to prevent falls. We are committed to excellent care, and keeping you safe is our top priority. Here are some safety tips to consider. Always ask for help. Tell us, how are you feeling? Know the side effects of your medications. Always choose safety over privacy. Limit your visitors. Make sure there is enough light in your room so that you don't trip on anything. Look out for items in your path, such as the ivy pole and clutter, while moving around in your room. Keep your important items within reach, such as the call button, your glasses, and your cell phone. Help us to do our best to keep your room as clutter-free as possible. Your family members should also help to minimize the clutter in the room. Get out of bed slowly. Sit at the edge of your bed for a few minutes prior to standing. If we ask you to call us before getting up, please do so. It is for your own safety. Let's have a look at post-transplant exercise guidelines. Despite the fall risk we've just discussed, physical activity and exercise can help combat cancer-related fatigue and weakness. How do you know if you have cancer-related fatigue? You may be feeling any of the following symptoms, such as weakness, drowsiness, tired as if you have the flu, difficulty concentrating, and difficulty performing your everyday activities. Exercise is one of the most effective tools we have to prevent and combat cancer-related fatigue. Research has shown that even light exercise may help lessen the symptoms of fatigue. Your muscles can become very weak from medications that fight the cancer. Your doctor or therapist can help teach you exercises that may prevent or minimize muscle atrophy. Other benefits of exercise include maintaining your physical function, combating fatigue, maintaining your muscle strength, enhancing your mood, preventing pneumonia, and it stimulates natural endorphins that give a sense of well-being. And also, it fights depression and the feeling that one has lost control over their life. So how do we exercise safely in the hospital? Walk in the hallway at least twice a day unless otherwise directed by your team. Be sure to stay on the ward floor. You should walk at a pace in which you can speak comfortably, not too intense. Wear a mask and athletic shoes. Dress comfortably. You should wear clothing that won't limit your movements. Wash or use hand sanitizer when you get back to your room. Nursing staff members are available to help with walking as needed. Sit up in a chair for meals and activities as much as possible. Even if you're just watching TV, try to stay out of bed. Perform simple exercises as instructed by your physiotherapist. Do report any of the following to your nurse or doctor immediately. If you experience shortness of breath, chest pain, coughing or wheezing, or weakness or dizziness. Let's have a close look at the dietary guidelines. And these guidelines follow a low microbial diet. A weakened immune system and a higher risk of infection come from microbes in food. By following safe food practices, you can reduce your risk of foodborne illness. So for cooked foods, proper cooking temperatures kill harmful bacteria present in food. Avoid all raw or undercooked meats, fish, poultry, tofu, eggs, and egg substitutes. Make sure the yolks and whites of eggs are firm and not runny. After preparation, food should be eaten as soon as possible. Do not eat potentially perishable foods that have been left at room temperature for more than 1 hour. Avoid any foods containing mayonnaise unless they are eaten immediately after preparation. Do not save to eat later. Dairy products. Reduce your intake of milk products for 100 days after the transplant, as your ability to digest lactose can be reduced by transplantation. Consuming dairy products early after a transplant can cause bloating, gas, cramps, and overgrowth of harmful bacteria in the colon. Do not use products that are near or past the expiration date. Consume pasteurized milk and dairy products only. Avoid soft and moldy cheeses, as well as those containing chili peppers or vegetables. Consume commercial milkshakes or supplements in sealed individual cartons, and do not consume them if there is a break in the container. Consume fresh fruits and vegetables. Thoroughly rinse fruits and vegetables under running water before eating, peeling, or slicing. Do not use soap, detergents, or bleach solutions to wash the produce. Use a small vegetable brush to remove the remaining surface dirt, and discard produce with cuts in skin, bruises, or mold that you can see. Soak raw fruits and vegetables, including those with skins or rinds that will be removed, in water for at least 2 minutes. Avoid all raw vegetable sprouts such as alfalfa and mung beans. Do not drink unpasteurized commercial fruit and vegetable juices and smoothies. Let's look at some other miscellaneous items. Avoid cold cuts, cheese, salads, salsas, and pre-cut produce from the deli counter. Avoid fermented food and drinks. Eat shelled, roasted nuts only. Eat commercial heat-treated honey. Seal and wrap leftovers, label with the date and time of preparation, and store in the refrigerator or freezer immediately. Do not eat if stored in the refrigerator for more than 24 hours. Do not thaw frozen foods at room temperature. Do not refreeze defrosted foods. Follow this diet during your transplant admission, and for the first 100 days after transplant, we use common sense when making food choices. Please remember, outside food is not allowed to be brought in during your hospitalization without your transplant doctor's approval. Let's turn to potential side effects post-transplant. Firstly, nausea, vomiting, and loss of appetite. These are the most common gastrointestinal side effects experienced after transplant. These problems usually get better as your blood counts recover. And fortunately, we have strong anti-nausea drugs that can prevent or decrease nausea and vomiting in most patients. Different drugs work for different people. Let your doctor and nurse know the minute you are nauseated so they can help treat you. Food choices to improve your appetite and manage nausea may be discussed with a clinical dietitian at any time. Mouth sores and swallowing problems. Mucositis is the swelling of the lining of the GI tract, and stomatitis refers to the swelling of the mouth. These problems result from chemotherapy destroying the rapidly dividing cells inside your mouth and your gut. To simplify, we call them mouth sores, and they are common following conditioning. As your white blood cells recover, your mouth sores will begin to heal. This side effect is very distressing for patients. Occasionally, patients may require strong IV pain medication. Please keep your nurse informed about any mouth pain and if the medicine is working or not. An important tip: don't worry too much if you cannot eat or drink much. You will also be receiving intravenous fluids to replace water and electrolytes. Don't force yourself to eat your favorite foods, or you may not like them later when you are well. Following these guidelines will help you prevent and cope with mouth sores. Brush your teeth and tongue with toothpaste after every meal and at bedtime. A soft bristle toothbrush should be used carefully to avoid injury to the gums. Notify your nurse or doctor if you have pain or bleeding. You may need to use a sponge instead of a toothbrush. Use salt rinses or other measures as instructed by your nurse. Do not use commercial mouthwashes that contain alcohol. Floss your teeth regularly as long as it doesn't cause excessive bleeding. Keep your lips moist with lip balm. And if you snack regularly, practice more frequent oral care. Also, if you have dentures, soak them in your usual cleaning solution as long as it does not contain alcohol. Do not reuse the solution. Remember to clean your dentures after each meal and at bedtime. Let's look at diarrhea or constipation. Swelling of the intestines from your treatment may cause diarrhea or constipation. Antibiotics and other medications may also cause these problems. Diarrhea can result in dehydration and/or irritated skin around the anus. Constipation may result in tears or bleeding. Any irritation or open area around the anus has a high risk for infection and needs to be reported to your nurse right away. Let your nurse know right away if you have any abdominal pain. How to manage diarrhea. Keep your rectal area clean and dry. Special wipes or creams may be given, and ask your nurse for assistance if needed. Let the nurse and the doctor know if you have more than 2 bowel movements in a day and if they are watery or difficult to control. The nurse may need to collect samples for testing, and it is important for the amount of diarrhea to be measured, and the nurse will advise you on how to collect this. This will help the nurses and doctors make sure that you don't get dehydrated. Let the nurse or doctor know if your rectal area becomes tender or if you have any bleeding, cramping or pain in your stomach or abdomen. And how to manage constipation. Drink lots of fluids and get out of bed to walk as frequently as you are able. Do not use suppositories or any home remedy without approval from your doctor. If you notice that you're straining to have a bowel movement, medications can be given. Let your nurse know as soon as possible. Do not strain to have a bowel movement, as this can cause injury and bleeding, which is dangerous because of your low platelets. Now let's look at some liver problems. Although rare, some chemotherapy medications can cause the veins in the liver to become narrowed. This is called sinusoidal obstruction syndrome, or SOS. It was formerly known as hepatic venous occlusive disease. SOS results in a decrease of blood flow from the liver, and as a result, fluid may build up around the liver and the stomach area. We call this ascites, and throughout your body, we call this edema. Also, it may cause the skin to turn yellow, which we call jaundice. The doctor will monitor liver function enzymes very closely and provide treatment if needed. If you are at high risk for liver complications, you will be given a preventative medication. Kidney problems. The doctor will monitor kidney function through blood tests as well as monitoring the fluid intake and output daily. Patients can assist the team in keeping track. Skin problems. Skin reactions to dressings, adhesives, tapes, and medications are quite common. The transplant team will determine the cause of the problem and how to treat it. Any rashes, redness, lesions, and itching should be reported to the team. What about heart and lung problems? Vital signs like your heart rate, breathing rate, blood pressure, and oxygenation is closely monitored, and any abnormal values will be reported to the transplant doctor. If needed, an EKG or chest X-ray may be performed. And hair loss. This is an expected side effect of the conditioning therapy and may affect all hair on the body. But this is temporary and will grow back. Neurological problems. Transplantation is a complicated procedure that can affect all parts of the body, including the brain and the nervous system. Potential neurological complications may be caused by factors such as medications, low blood counts, or fluid and electrolyte imbalances. Symptoms of neurological complications vary, and your transplant team will be assessing for these complications every day. Let your nurse or doctor know if you're experiencing the following: headache, visual changes, dizziness, weakness, numbness or tingling, anxiety, depression or hopelessness, abnormal muscular movements, shaking or jerking, difficulty sleeping or staying awake. Your vital signs, your heart rate, breathing rate, blood pressure, and oxygenation will be monitored very closely, a minimum of every 4 hours. Any abnormal values will be reported to your transplant doctor. If needed, additional testing such as your EKG, chest X-ray will be performed. Let's have a look at engraftment syndrome. Engraftment syndrome occurs when a rush of chemicals called cytokines flood the body very quickly right before the white cell count rises. The most common symptoms include fever, skin rash, swelling and rapid weight gain, shortness of breath, and changes in kidney and liver function on blood tests. Engraftment syndrome is treated with medications called steroids, and symptoms usually improve quickly. Post-transplant lymphoproliferative disorder. PTLD is a growth of your lymph nodes that happens from infection with a virus called the Epstein-Barr virus, or EBV. This virus can do this while you are on immune-suppressing medications. EBV blood levels will be measured after transplant so that if the levels rise, treatment can be started right away. Very important is graft versus host disease. What is graft versus host disease? It is a common and potentially serious complication after your stem cell transplant. Understanding what graft versus host disease is and how you can help prevent it is an extremely important part of your pre-transplant education. Your donor's immune system is contained in the stem cells that you receive during your transplant. Recall that the role of the immune system is to fight. It fights whenever it encounters something it does not recognize as self. So graft versus host disease occurs when the donor's transplanted immune system, in other words the graft, begins attacking your body cells, and you are the host, because they appear foreign. In other words, the donor cells treat your body's normal cells like an infection and try to destroy them. The main risk factor for developing graft versus host disease is mismatched HLA typing. And this is why we are so careful about choosing the best possible matched donor for your transplant. However, even perfectly matched transplants may result in graft versus host disease. It can range from mild to life-threatening. If symptoms of graft versus host disease appear, which is explained in detail in the next 2 sections, they must be reported immediately to your transplant team. So the 2 types are acute graft versus host disease, which appears within the first 100 days after your stem cell transplant. Early intervention is key in managing acute onset. Please be sure to report all symptoms to your transplant team as soon as possible. Acute graft versus host disease primarily affects 3 organs. First, your skin. This results in a rash. The rash may begin on an isolated area, commonly the palms of your hands and soles of your feet. It may spread out all over the body, and the intensity of the rash can be mild redness like sunburn to severe blisters and peeling. Second organ, gastrointestinal tract. This primarily results in diarrhea. The frequency and amount of diarrhea ranges from mild to severe. And thirdly, the liver. This results in changes in liver function measured by blood tests. It can also cause jaundice, which is the yellowing of skin and eyes. And again, severity can range from mild changes in liver function to complete liver failure. Now let's turn our attention to chronic graft versus host disease. This typically occurs 3 months to 3 years after your stem cell transplant. It may occur in any post-allogeneic patients, but it is more common in those who have had acute graft versus host disease. Symptoms of chronic graft versus host disease may range from mild to life-threatening, and early intervention improves outcomes. Report any symptoms as soon as possible. Chronic graft versus host disease may affect the skin by darkening, thickening, or hardening, dryness or flaking, and peeling. May affect the eyes, causing dryness and irritation, sensitivity, and perhaps cataracts. And the GI tract, dry mouth, cavities and gum disease, diarrhea or problems digesting food, liver inflammation, and difficult swallowing. In addition, joints may be affected by pain and weakness and swelling. Lung problems include a cough or shortness of breath and hair loss. Prevention and management of graft versus host disease. The transplant team will make every effort to prevent this. Prevention begins by selecting the best possible HLA donor for your transplant and also the use of your immunosuppressant medications. Again, let's look at the role of the immunosuppressants. Firstly, to restrain your own immune system so that it does not reject the transplanted donor cells, and similarly to restrain the donor immune cells so that they wake up slowly and calmly inside of your body. If symptoms of graft versus host disease appear, your transplant team will give you medications called steroids to further suppress the donor's immune system in your body. The dosage of immunosuppressants you are taking may increase, and additional immunosuppressants may be given. For some of these medications, your doctor will carefully monitor the level of immunosuppressant in your bloodstream and make changes to your dosage as needed. The goal is to, very slowly, over months to years, lower the dose until you no longer need them at all. Sometimes, signs of graft versus host disease may appear shortly after the doctor lowers your dose. It would then be increased, and once the graft versus host disease is under control, another attempt is made to lower the dose. This cycle of careful assessment for graft versus host disease, trial of lowering immunosuppressant dose, and reassessing for signs of graft versus host disease is an expected part of your post-transplant care. The best way for you to participate in graft versus host disease prevention is the following. Always comply with the immunosuppressant medications prescribed to you. Be mindful of changes made to your dose. Be sun safe. Even a mild sunburn can trigger graft versus host disease that can cause problems for years. Stay in the shade. Apply sunscreen, and with a minimum sun protection factor of 30 to exposed skin, avoid midday sun, wear a hat, and cover up as much as possible. Follow these guidelines on both sunny and cloudy days. Report any potential symptoms immediately to your transplant team. Now, let's look at graft versus disease. The donor's immune system is by nature aggressive and trained to kill foreign invaders like bacteria. Now imagine what that immune system will do when it finds leukemia, lymphoma, or myeloma cells inside your body. When your donor cells, remember the graft, destroys leukemia, lymphoma, or myeloma cells remaining inside your body, this is called graft versus disease effect. Currently, modern medicine does not have a way to measure whether or not GVD is happening. The same cells responsible for GVD are also responsible for causing GvHD. Patients who experience mild GvHD are likely benefiting from the protective effects of graft versus disease and may have a decreased risk for relapse. But unfortunately, there is no way to turn up the graft versus disease response and turn down the graft versus host disease, but researchers are busy working on it. For patients that receive a non-myeloablative transplant, the transplant doctor is relying entirely on the immunological effects of graft versus disease to attempt to cure the disease. For myeloablative and reduced intensity transplants, it is chemo and radiation therapy combined with the GVD effect that hopefully cure the disease. Graft versus disease also is the driving force behind donor lymphocyte infusions. We'll talk about this later. So what is engraftment? Engraftment is a cause for celebration. You are almost ready to go home. Imagine a planted seed buried deep in the soil. It takes a certain number of days before you see the plant begin to grow. In the setting of SCT, this is engraftment. Engraftment occurs when the infused donor stem cells move to the bone marrow and begin to grow and divide. Your full blood count tells us when engraftment is occurring. Neutrophils are the first to engraft. Platelets are usually the last. You will be discharged from the hospital when your blood counts have returned to a safe level decided by the doctor, and you can take care of your basic needs such as shower, dress, and walk. Chimerism testing of your blood is done to check engraftment of the donor stem cells. This tells us the percentage of donor DNA inside your blood and bone marrow compared to the percentage of your own DNA. The desired test result is more than 95% of the donor DNA. This test will be repeated several times as you move through your recovery. Low percentages of donor DNA on chimerism studies indicates that the graft rejection has occurred or failure and will likely require further investigation and treatment. Let's look now at your discharge instructions. Your transplant team will review essential information with you and your caregivers prior to discharging you. Your prescriptions, your clinic appointments, and any questions you may have will be discussed. Prior to going home, you need to make sure of the following: that you have a caregiver for the first 100 days after transplant, except when you are in the hospital. Caregivers should have received an annual flu vaccination. The house must be clean. Dogs and cats are clean and well groomed. You are not to clean litter boxes or pick up after your dog. You are not to clean cages or tanks such as snakes, hamsters, rabbits, lizards, fish, etc. You need to be sure that you have an accurate thermometer so you can take your temperature at home. You need to also ensure that you have all of your prescriptions in hand before discharge and understand the schedule for taking them home. Depending on your medical condition post-transplant, you may need to arrange for local housing close to the transplant center. You have an alternate caregiver should your primary caregiver or children get sick.